In this video, we're going to talk about how specific over-the-counter medications can help ease your chronic pain, how they are hurting your chronic pain, and how natural alternatives can be effective. So this is your arachidonic acid pathway. It's the acute inflammatory pathway, which we'll harp over and over again. Acute inflammation is a good thing in the right amount. But when it crosses that line and now it's too much, that's when we start to cause more pain and inflammation than we need. So when a cell membrane is exposed to stress, either through tissue damage and injury or infection, it releases arachidonic acid, which then splits into two pathways. The first being your white blood cells to help fight that infection and heal damaged tissues. The second being cycloendoperoxides, which get broken down even further. Thromboxanes, prostacyclins, these help control blood flow, so vasodilation, constriction, and the amount of platelets that are released. But most importantly is prostaglandins. When these get triggered, they produce pain, inflammation, redness, and increase in temperature, the cardinal signs of an infection or tissue damage. Over-the-counter pain relievers like NSAIDs, nonsteroidal anti-inflammatory drugs, ibuprofen, Aleve, Advil, even Tylenol, they help by blocking an enzyme. Well, actually, there's two of them right here called COX-1 and COX-2. We're just going to abbreviate NSAIDs for short to be your over-the-counter pain relievers. So when you take these, everything below gets blocked or at least reduced. So we're reducing the prostaglandins, which means you feel less pain, have less inflammation, there's less redness and less heat. So yay, we have less pain, we have less inflammation, great for the chronic pain sufferer, except for the story is not that clear cut. Prostaglandins, they seem like it's all bad, but that's really the case in the body. Everything is within checks. Prostaglandins are also responsible for protecting your gut lining, which I cannot emphasize enough is crucial to your treatment of getting out of chronic pain. Helps with kidney blood flow, and it helps with platelet formation. So if we are consistently blocking this by taking over-the-counter pain medications every day, because surely if they're over-the-counter, they're safe, now we're going to contribute to things like ulcers, acid reflux, kidney disease, and bleeding disorders. Now, what I can almost guarantee you haven't been heard is that taking over-the-counter pain relievers can actually double the duration of your pain and inflammation. And that's because prostaglandins actually trigger a positive feedback loop to increase lipoxin A4, one of those white blood cells. This one is responsible for clearing all of the inflammation that is synthesized through this side of the pathway. So the damage has already been done. The tissue injury, the infection, it happened up here. The medication is down here. It's just making you feel better by reducing the pain and inflammation, but we've cut off the second part of the healing mechanism, and that's why over-the-counter pain medications can help you feel better, but actually prolong your suffering. So now that we understand all of this, we can better understand how natural alternatives can help your chronic pain. You see, a cell membrane does not need to have physical injury or an infection to release arachidonic acid. Your diet can do that. Large amounts of omega-6 pro-inflammatory fatty acids can synthesize arachidonic acid, which means that a diet high in omega-3 anti-inflammatory fatty acids can help modulate this pathway. And I love fish oil because it's not shutting down the pathway at particular enzymes, it's modulating the whole system, meaning that you're still producing appropriate amounts of inflammation at the right time to help trigger a healing response, and you're also clearing out inflammation when necessary. This is how steroids can help ease your chronic pain, how they can make it worse, and what natural alternatives we have. So this is your arachidonic acid pathway. Please go back, watch my last video where I break this pathway down even further. But essentially, it's your acute inflammatory pathway. When a cell membrane is exposed to stress, either in the form of physical tissue damage, an infection, or autoimmune disease, to give a few examples, it releases arachidonic acid, which breaks into two different pathways. one being the release of white blood cells. We consider this to be good because it helps fight the infection, heal those damaged tissues. And then the other side of the pathway is cycloendoperoxides, which at the bottom here, prostaglandins. This is what's responsible for producing pain, inflammation, redness, and temperature. So we consider this the bad stuff. Steroids block the pathway way up here at the top so that you don't release arachidonic acid, or at least you release a lot less of it so that you get a lot less of the pain, inflammation, temperature, redness, which is, hey, a huge win for you, the chronic pain sufferer, but it comes at the cost of now not getting all of the white blood cells to actually help fix the problem. Now, I like steroids for a diagnostic purpose because if your chronic pain is heavily being driven by inflammation, steroids are going to give us that answer immediately. They work almost immediately. So within a couple of days, if you're feeling a whole lot better, that means that your chronic pain is heavily being driven by inflammation. If you don't feel any bit better, that's because your chronic pain is being driven by something else, and that's good feedback for us to tailor your treatment plan. But this means that steroids should not be taken long term. And most people know this because of the decrease in immune function. But that's just the beginning of the problems because we're blocking the pathway so high up. Steroids also contribute to blood glucose dysregulation, which I've talked about in previous videos, how detrimental sugar can be for your chronic pain. Also, steroids disturb your sleep, which is a great time for healing and clearing inflammation. Compounding on that, steroids create fluid retention, so we're not clearing out that inflammation even further. And they can also contribute to muscle loss, which I don't need to explain why that's a bad idea. So what natural alternatives do we have? Well, you do not need stress, infection, autoimmune disease to produce arachidonic acid. Diets high in omega-6 pro-inflammatory fatty acids will also produce arachidonic acid, which means that omega-3 anti-inflammatory fatty acids will help modulate the system. And I say modulate, and the reason I love omega-3s, especially from fish oil, is that it's not shutting down any particular pathway, it's modulating it, meaning that we're releasing appropriate amounts of inflammation at appropriate times, which is really important and necessary for the healing response. These omega-3s are then going to help clear that inflammation after it's been used so that we can actually use the system appropriately to heal damaged tissues and fight infections and not have it contribute to your chronic pain. This is how different anesthetics like lidocaine, bupivacaine, ropivacaine help your chronic pain, how they don't help your chronic pain, and what natural alternatives we have for them. To understand how these work, we first have to understand how a nerve fires and sends a pain signal to the brain. So, your nerve currently is at rest. The soma, or the head of the nerve, receives an input, whether that's pain or something else, and attempts to send electrons down the axon or the tail of the nerve until it reaches the axon terminal, where it connects with the soma of another nerve, kind of daisy chaining those nerves together until it reaches your brain, and your brain perceives that signal as pain. So in order to send electrons down this axon, we have to open up sodium-potassium channels. Sodium then rushes into the axon, which pushes those electrons down the axon, which is seen as that spike. And as it gets further down, more sodium rushes in to keep pushing those electrons down the axon. Well, as this is happening, as the electrons move past, we need to reset the nerve upstream. To do that, potassium, which is inside of the cell, inside the nerve, leaves. And that's seen as this dip. So more potassium leaves, except for, too much potassium left. So now we have this hyperpolarization, which just means that a little bit more sodium needs to come back into the cell to help balance that off and get us back to a baseline so that another nerve conduction can happen. Anesthetics like lidocaine work because they block this sodium potassium channel so that sodium can't get in, causing that nerve to fire, and it prevents potassium from coming out so that the nerve can't reset itself to fire again. Now, if you're suffering from chronic pain, this is actually a pretty decent mechanism to prevent that pain signal from getting to your brain. But that also means that it's preventing normal sensations from getting to your brain. It can interfere with muscle contractions and it can also disrupt normal heart rhythms. Not to mention the glaring fact that this is just stopping that pain signal from getting to your brain. It's not addressing what is actually producing that pain signal. Because remember, and this is a hill I will die on, there is no such thing as a hyperactive nerve. Nerves need an input in order to fire, and if you can identify that input, you can stop it. But anesthetics do not address inflammation. They do not address mechanical dysfunction or damaged tissues or even repressed emotions. Those are the things that are causing this nerve to fire. Lidocaine is just preventing that signal from getting to your brain. Now, one of the most common natural alternatives to anesthetics like lidocaine is actually capsaicin, especially in the topical form. Capsaicin keeps that nerve conduction in a depolarized state, meaning sodium can get in, but potassium cannot leave to help that nerve reset itself. And if the nerve can't reset itself, it can't fire again, meaning that nothing is going to get to your brain. This is how anticonvulsants like gabapentin and pregabalin can help your chronic pain, how they can worsen it, and what natural alternatives we have in their place. In order for a pain signal to get from the source to your brain, it needs to hop from one nerve to the next. Now, in the last video about anesthetics, especially like lidocaine, we talked about how that pain signal makes its way across the nerve. But now we're going to talk about how gabapentin, pregabalin help prevent that signal from jumping from one nerve to the next. So a pain signal is coming down this nerve. The very first thing that happens is this calcium channel opens up, allowing calcium into that nerve ending. Then there is a release of glutamate, which is an excitatory neurotransmitter from this nerve to the next nerve. If that glutamate makes its way into this next nerve, then the nerve signal just keeps on going to the next nerve and eventually to your brain. Keeping this process in check are inhibitory interneurons that release GABA. GABA is an inhibitory neurotransmitter that helps kind of just makes nerves less excitatory, less likely to fire when they don't need to. So if your chronic pain is more nerve-based, like peripheral neuropathy, central sensitization, fibromyalgia, these drugs are actually probably going to work pretty well for you. But the problem is they don't target just the nerves that are causing pain. This is a global act on all of your nerves. So we're going to start to see things like dizziness, sedation, brain fog, swelling, and slow coordinations, which are not exactly ideal if we're trying to actually heal from chronic pain. So now that we know all of this, how can we simulate the effects of gabapentin or pregabalin? Well, the first thing we need to do is reduce the amount of glutamate, and magnesium does that really well. One, because it balances calcium, but two, it helps reduce the amount of glutamate that is taken in by the receiving neuron. Now, the next thing that we need to do is to increase the amount of GABA. And interestingly enough, your body actually makes GABA from glutamate, but the enzyme responsible for this conversion is blocked by gluten. So just another reason why going on a gluten-free diet is going to be beneficial for almost every single chronic pain sufferer. Other ways to help boost GABA production in your body include getting more vitamin B6, eating more fermented foods. That's because a large amount of GABA is actually synthesized by your gut microbiome. So eating fermented foods, taking probiotics, just taking care of your gut health in general, super important. Exercise, or I like to just say movement. I think it's a little less triggering. Yoga and meditation are all great ways to help boost the amount of GABA in your body.